Thanks for listening to the Pharmacy Podcast Network.
Ever since COVID, what we know to be the norm is rapidly changing. In order to adapt to this, your business must adjust and transform accordingly. For pharmacies, unlocking the profession's potential to improve patient care is where this opportunity lies. Today's product-focused role of the pharmacist calls for the industry to move toward clinical services. The focus will be on prevention over treatment, and care will happen in the home or community. As accessible and trusted healthcare personnel, pharmacists can play a big role. Happier at Home harnesses this opportunity by showing the benefits of expanding your pharmacy into home care services and how this is a recipe for success. Innovation and growth will help community pharmacies to continue to exist and thrive in the future.
Hey, welcome back to Happier at Home PRN podcast. I got the microphone today. Debbie is busy. Shout out to Debbie Marcello, who has helped to start a home care initiative throughout the Pharmacy Podcast Network. This goes deeper than home care. We're connecting digital therapeutics, and I know people are rolling their eyes, but it's actually happening. It's happening in mental health. It's happening in addiction medicine. It's happening in monitoring of different things that the patient's going through. And I wanted to bring someone in to talk about Happier at Home specifically, and what that means for communities and home care, and dialing in really other things that the interest between the patient, the physician, and the pharmacist, what could you guys create? Well, I could shout some things out, but we're going to get into these things of the merging of home care with community pharmacy. Patrick Devereux, it's good to have you here.
Thank you, Todd. It's great to be here.
All right. So first of all, we got to talk about where you're from. And you showed me kind of like your landing page, per se, at Happier at Home. But I can't remember what part of Alabama Birmingham is in. So tell us where you're at.
Yeah, we're in the central part of the state, largest city in the state. So we're in Jefferson County. So not quite, I would say north central Alabama is really where Birmingham is. So about 3 hours from the coast and about 2.5 hours west of Atlanta.
Independent pharmacies, owners that I've talked to for the last 20 years, the majority of them, not all of them, but the majority have some kind of pharmacy in their blood, and it kind of got them on a track that, hey, I'm going to open up my own pharmacy someday, or I'm going to adopt one, or I'm going to whatever. But how did you go from pharmacy school to owning your own pharmacy?
Well, the path I took was after graduation, I pursued a community pharmacy residency and completed a community pharmacy residency out in Atlanta at Mercer. With two fantastic mentors, Jonathan and Pam Marquis, and learned a lot about, I really had not been in an independent pharmacy much before then. In fact, my goal in going into the residency was to develop clinical services that I could utilize in other areas of practice, chain pharmacy, things like that. Chain pharmacy was really all I knew going into the residency. And so once I was able to see that, and see a lot of what Jonathan and Pam did day to day, and the way that they worked with their teams and worked independently of a chain structure. I said, I think this might work for me. This fits. I think I really like doing this. I really learned a lot about business and clinical services and all kinds of operational things. So that's really where it started. I really had no exposure to pharmacy in my family, no exposure to independent pharmacy really in pharmacy school, except for one rotation my first year at a medicine shop. That was it.
You know, that's unusual in my conversations over the years, because usually there's some kind of connection back. But I will say we need more of this, because every time you bring some kind of outsider's perspective or a brand new, fresh perspective without any type of understanding of what it was like before. I think there's a lot of innovation in that. I think that that's actually what's happening. It had to happen because the payment model right now in surviving as a pharmacy owner, and then the ability to build services through ambulatory care and emergency room and transitions of care and pain management. We can keep going, but community pharmacy is the hub of healthcare. We know what's happening with pharmacy deserts. Pharmacy deserts are going to put more pressure on the lack of long-term care pharmacy facility beds. It's going to put more pressure on the Medicaid, Medicare systems. It's going to put a ton of more pressure on the hospitals because of people that aren't getting control, or their health isn't under control. They're not seeing a pharmacist. They're not seeing a physician. They live too far away. And now they're in the emergency room and they're staying in hospitals for 14 days. And it's just, I don't have to tell you, but I want to dial in, and a shout out to Jonathan Marquez, because if I ever knew I had even a fraction of the impact that Jonathan has had on so many pharmacist businesses because of his leadership down in Georgia, his understanding of cannabis and his understanding of the future of pharmacist role, his understanding of pharmacogenomics. Like I could talk about it. We should have to just have a podcast about Jonathan Marquez, but now he's helped you in understanding. So the bigger picture now, which you've already understood, is starting to insert other services that we know your community needs anyway, A, but B, what's going to happen when we hit this 2 more years, 5 more year mark, where we have an influx of people that need these services who are 70 years old right now. They hit 80 or they hit 90. Some things start to change. They need home care services. Mm-hmm. So we need pharmacists to understand home care specifically and what that means, and then implement that into community pharmacy. Like what you're doing is the beginning of something that 10 years from now, it's not going to be a trend anymore, but this is the time to get in. Like, tell us why you did it. What from your perspective?
Well, when I started looking at this model, it was about 2 years ago or so. It started with a desire of having a business and income stream that just did not depend on trends in the pharmacy industry. That's really where it started. But then the more I dug into this, and Debbie and I connected through email. She was getting some of her newsletters, and I said, well, this might actually really fit well with what we're trying to do in the pharmacy. So we started having some conversations about what it would look like, and walked through what it could look like, what it has looked like for other independent pharmacists that she's worked with. It just was a great fit. But it started out as understanding, like you said earlier, that the industry has just changed tremendously, and that I really needed to diversify where things were coming from an income perspective, but also from a services perspective, and to see if this expansion into this would fit well with that.
I love that because it's coming from a place of sincerity, because you as a community pharmacy owner see things that the community needs. It's probably in the back of your mind the whole 2 years ago, 5 years ago, however long you've been in this. And now you have a mechanism in a package from an operational perspective, from a marketing perspective. I love Debbie's marketing and the whole vibe, and how she represents the whole concept through a lot of public relations and news education to her own, I think it's her Fox network or something. But that education is part of this. So how are you educating your community that you're now tied in, or I don't know how you put it to the community from like a press release perspective, but how are you educating the community that, listen, if you need home care services, we now have this, and this will help us all be more educated about how to care for your mom or care for your dad or care for your loved one that you might be states away and your poor mom has nobody to care for them. So talk to us about the connection.
Well, at least from the pharmacy perspective, we're doing the traditional marketing strategies inside the pharmacy, bag stuffers, things like that. But really where it comes from in the pharmacy is just listening to when we're talking with patients, when we're giving immunizations, when we are talking about medication changes, or we see that there's been a hospitalization. A lot of times it's just us talking with caregivers that are their family caregivers that are already taking care of mom and dad, that definitely are burned out, that definitely need some help. And so our communication strategy involves peace of mind for family members. 9 times out of 10, when we take on a new client, it is because the family just simply cannot provide the level of care that they need, whether it's just physical assistance or whatever. And you mentioned, what about families like that are 2 states away? And Debbie has helped us create strategies that allow us to work with families that are not in the area. We onboarded a new client yesterday whose daughter is in Florida. And so we have developed communication strategies with her, so that she can see on a consistent basis every time, we're there, what are some of the things getting done at the visit with mom and dad, and providing that peace of mind that, okay, they're going to be fine. They're going to age in place right now at the level of care that they're at right now. They can stay there. So it's really listening and trying to provide peace of mind, and really asking a lot of questions, and trying to learn a little bit more about if they come to us, or if they go through a site that they're looking for in-home care. It's just asking the question, what is it that led you to look for home care today? Or have you ever done that before? But sometimes it's even more obvious when we're in the pharmacy and we're talking with a patient who's just like a caregiver specifically for a patient. And they're like, I just need help. I need help. And I don't know where to turn, and we've been seeing that forever. So yes, traditional, outreach strategies, but really it's listening and asking questions and trying to frame our solutions in a way that is going to provide peace of mind to families and caregivers.
So have you experienced the knowledge opportunity? Let's talk about barriers to care for a quick second, because I want to set the stage for this for you. So we know that family members that try to care for their loved one, parents or whatever, they may not understand, obviously, medication management. They don't understand the moods that might come into the play for dementia patients, or mental health, or depression. So you have a vibe on that as a pharmacist, which is cool. So how are you so far, or anticipating, of seeing the advantage of knowing what's happening in the environment of your patient, and now being able to medicate properly, make adjustments, suggestions, possibly supplements, bringing in the DME because something is now happening in the home where they're falling, or they need some device, and now you have that data. So talk to me about that advantage.
Yeah, a lot of it is identifying unmet needs from asking questions of the caregivers, whether it's a caregiver in the family or a caregiver that is working for us. We train our caregivers to look for those unmet needs. And sometimes the family might not even realize that the pharmacy has this, and this available. Many times what we've seen, we've really seen this a lot, is where there's been a really rapid decline in a family member that they're looking for care for, or all of a sudden there's this major transition with medications. Now all of a sudden they're managing 12 medicines, whereas before they were managing 4 or 5. And they've been in a lengthy hospital or rehab stay. Understanding that landscape as well is also very important. I had a conversation with the client that we onboarded yesterday, who was sent home from rehab with a lot of medicine. But of course, when they leave rehab, there's no refills on that medicine. And there's not really a plan to get those medicines to the patient after they run out. So I did a medication reconciliation with them last night, walked through the meds and said, okay, here's what you've got to ask the doctor for, because they started him on this in the facility. And he's not on this at his regular pharmacy. He's not using us yet, but we're looking at the regular pharmacy records. We didn't see any record of that prescription. So I just wrote a note. Here's what we have to get. So it's understanding those aspects of not only what it looks like in home care, but what does the discharge and clinical process look like in transitions of care, which is something I've been paying attention to, and most pharmacists have for a decade or more. And understanding that process has also positioned us, I think, to be pretty unique in the home care space, because we know what the process looks like, and sometimes what are some of the questions we need to ask during the discharge process to make sure that they have everything they need for medication or DME and things like that.
So now I'm starting to really put some puzzle pieces together. I have an advantage. You're in the trenches. You have to build your business. I get to see things from the clinical trial perspective and talk to people about, biosimilars and specialty pharmacy. And when I listen to you pharmacy business builders, and it makes you, it's a feel good story, because you're doing this. This is impacting your community, literally. It's making the community healthier, but you're bolting in things that are giving you an ability to expand as a business owner. And that's exciting. And I think of, for example, we have a podcast that we do with RxMile. RxMile is a technology system that integrates with your pharmacy system. It makes sure that the tracking of your patients' meds are met, of course, and things are efficient. But more importantly than that, you can deliver patients to their appointments, or you can take them from the emergency room back to their house. And if that coordination of data, that now the home care organization knows what's going on, your transportation system knows exactly what's going on, the pharmacy now knows what's going on. Bring in your congressperson about a year from now and do a tour of what you're doing for your community, and watch what happens with some of their political aspirations to make sure that their public and constituents knows that they care about the expansion of seniors. But this could become like part of their little political platform. And I don't care, as long as they're bringing attention and helping to change things, that's great. But you kind of see where I'm going with this, and where what the seeds that you're planting.
Right. It is about improving the health and well-being of our community. And those of us in independent pharmacy, I don't know any independent pharmacist that's not in it for that reason. Yes, there's definitely a business there. Yeah. But there's also dozens of other things you can be in business for and make money if that was the only goal. And the level of care, the level of getting our sleeves rolled up and getting the work done and working with our senior population, all of our population, is part of the independent pharmacy brand, if you will.
All right. Are you going to the National Community Pharmacists Association Super Bowl event in October 26th? Are you going?
Unfortunately, I can't make it this year. Yeah.
We're excited. So Debbie and Happier at Home will be there. We'll definitely be there. We want to talk with a bunch of pharmacy owners and get people excited about their ideas, because this is a platform. The whole thing is kind of like a Lego system, but you really get to build it the way that you want. It's still an independent thing. It just gives you so much guideline and so much branding, really, that I think is so important. And it really makes you're positioned that you're already known as a professional, but now it's positioning this business extremely professional. And there's, standard operating procedures and a whole way of, so I think it's another step up to show the value of independent pharmacy community to your community. Number one, that's the most important. But from a selfish perspective, I want to see this used as a way of showing the nation and telling success stories, so that other communities are like, oh, that's why my community pharmacy is so important. And I think that's going to help slow down the closing of independent pharmacies, if we can find other ways to make money and bring value.
Absolutely.
All right. We are out of time, but we've enjoyed this conversation with Patrick Devereux. We want to also say, if you go to happieratHomeFranchise.com, once again, that's happieratHomeFranchise.com. It'll be in the show notes. But I also want you to check out any questions that you have. I want you to check out their services section on their website, the contact section. And then if you want access to some of these pharmacy owners, like they are willing to tell their story. Patrick, are you on LinkedIn, or is there a way that listeners might be able to reach out to you?
Yep, I'm definitely on LinkedIn. Would be happy to connect and answer any questions that any independent pharmacy owners have.
What's the name of your community pharmacy again?
The name of the pharmacy is FMS Pharmacy, and we're located in Bessemer, Alabama.
Excellent. Patrick, I wanted to thank you for being on Happier at Home PRN podcast. This has been fun talking with you. We hope to meet up with you at some conference at some point.
Thank you, Todd. It was my pleasure.